A patient with direct CCF, on expert CT angiography, one can visualize the exact site of the fistula. The venous drainage is anteriorly into both superior and inferior ophthalmic vein, and as well as drainages into the superficial middle cerebral vein, causing significant cerebral venous congestion. Through the intercavernous sinus, it communicated with the opposite side, which in turn had an anterior drainage into the ophthalmic vein and posterior drainage into the cerebellar veins, causing cerebellar venous congestion. A directed 2D run shows the rent site along with ophthalmic vein drainage, superficial middle cerebral vein drainage causing significant cerebral venous congestion, and posterior fossa drainage causing significant cerebellar venous congestion. A contralateral injection helps identify the rent site. The idea here is to occlude the dangerous venous drainages, followed by occlusion of the fistula completely while preserving the parent artery. A hyperglide balloon was taken across the rent site from a guiding placed at the proximal ICA. Another guiding catheter was taken up to the petrous ICA. Two coiling microcatheters, both Onyx compatible, were placed in the posterior sac. Microcatheter injection showed filling of the posterior sac with intercavernous connection and posterior drainage. Following that, large diameter coils were deployed into the posterior sac sequentially. Following that, Onyx was injected under biplane fluoroscopy with balloon inflation to avoid Onyx reflux into the parent artery. Note the spread of Onyx in the intercavernous sinus. Thereafter, two microcatheters were placed into the anterior sac and progressively coils were deployed in the anterior sac as well as across the rent as noticed on the roadmap here. Onyx was injected from the anterior microcatheter which showed spread of Onyx into the ophthalmic vein. Thereafter, Onyx was injected from the microcatheter that was across the rent site with balloon inflation. Note spread of Onyx into the contralateral side through the intercavernous connections. With further injection, you note that there is further spread into the intercavernous sinus into the contralateral segment. Following that, you notice Onyx spread anteriorly into both the foot of the superficial middle cerebral vein and as well as the ophthalmic veins. Injection revealed that the anterior drainage had occluded. There was no reflux into the brain, into the superficial middle cerebral vein. However, there was an intercavernous connection that was persistent, which was eventually draining into the posterior fossa veins. Therefore, Onyx was further injected from the catheter at the rent site. Note the spread of Onyx into the intercavernous sinus. This is done under balloon inflation to prevent reflux of Onyx into the internal carotid artery. This native image shows the balloon that has been inflated within the internal carotid artery and the Onyx and coils within the sac. Post-procedure angiography shows complete obliteration of the fistula and the veins being utilized by the brain now.